Hello everyone, welcome back to my channel. My name is Alicia and I'm working as a registered nurse in Ireland. Today I'm going to talk about nursing interviews in Ireland. I'll divide this video into two parts. Part 1 will consist of all the questions which they usually ask from everyone, irrespective of their experience, and part 2 will consist of questions they usually ask from ward nurse. So make sure you watch this video without skipping and you watch this video till end because each and every question is very important. So let's start. First, they will ask you some warm-up questions, and these warm-up questions are usually from your CV. So make sure you go through your CV just before your interview, and they will start asking you about your current employer, your hospital, and what your department in which you are working and how many patients you get every day. So they will ask just some warm-up questions, and then very important, if you have any work gaps, so make sure you should have some good explanation about your work gap, because they're definitely gonna ask about your work gap because they want somebody promising, because they want someone who is gonna stay in their hospital for a long time. So if you have left some hospital just after 6 or 8 months, or you have worked there just for a shorter period and then you jumped into some other hospital and then you again jumped into some other hospital, so they will definitely gonna ask you why you changed hospital and what was the reason. So you should have some good explanation for your work gaps and for every other hospital. So don't just say I was seeking for a better opportunity or some very common answers. Just give some good explanation. So apart from that, they will definitely ask you about your previous employer, that why you left your previous employer and why you joined your current employer. So don't say that you were getting good salary or something like that. Make sure you should say something which is meaningful and which definitely makes some sense. After some warm-up questions, they will jump into some commonly asked questions, and those, I have a list of commonly asked questions, so I'm gonna go through these questions one by one. So first one is, plan and organize your day from the time you take handover. So before you answer for this particular question, make sure you organize yourself in your mind before you say anything, because during interview we are very nervous and we end up creating a mess. So make sure you organize your answer and just take few seconds, organize your answer. And in most of the country, nurses are working only 2 shifts, day and night, but in my country we were working 3 shifts. So you can start saying like this: in my hospital we work in 3 shifts, morning, evening and night. So I'm gonna describe my morning shift. Make sure you say this because our routines are different in morning, evening and night. And if you're not particularly saying which shift, so you will end up creating a mess for yourself and for them also. So make it very easy for them also to understand what you are doing and what is your exact responsibility. So make sure you organize your answer and you start saying the moment we enter the ward, we check our assignment, we check our inventories, we start taking inventories, and then jump into the handover and say how you take handover. And make sure you specify each and everything, how you take handover, and soon after handover what you do, and explain your role according to your experience. Like if you're working in ward, you might be doing some other things, and if you're working in theater or ICU, you might be doing some other things. So just tell them each and everything one by one. Like if you do after handover, if you give medication, so say I'll do my medications round, I'll check my obs, I'll check dressings, if you're working in a surgical department. And then you will say about the discharges if you have, and new admissions, any transfers, doctors round, pharmacy round, physiotherapy. So you can add on accordingly. So make sure you organize your answer well enough before you answer them, and just be very particular, and just be very, if you're gonna reply don't explain each and everything, just give them kind of sub points, like I do this, so they know how much you're doing and how you're doing. Another one is, how do you support student nurses? So if you have student nurses working with you, you can easily answer this question as per your experience. But if you don't have student nurses working with you, don't just say we don't have any student nurses working with us. End of your answer. No. So if you don't have any student nurses working with you, you can say we don't have any student nurses working with us. But since I was also a nursing student before becoming a nurse, I would like to answer this question as per my experience. So that sounds something impressive. So you can say like this, and then you can add on that I'll support her by teaching her, and I will support her by demonstrating the procedure, and I would like to give her her own space to do the procedure, and I will supervise her, I'll be with her, I will try to acknowledge all her queries, and I'll not rush her with anything. So many things like you can just add on with your own experience. Next one is, how do you handle a difficult patient, or how do you handle a difficult family member? So I'm sure you might have handled a difficult patient or difficult family member in your career, and I think every nurse can easily relate to it and can easily answer this. But just to explain a bit, I would add on that you can say like you should add some lines like we will not raise our voice, and we will not try to argue with them, and you can also add on, we will try to involve seniors in our conversation, or I will try to report it to my manager, I will not try to handle on my own if it's a very difficult patient. And you can add more things as per your experience. Another one is, if you're working as a team leader in your shift and colleague from your next shift ranks sick just before the shift, how you gonna manage it? So if I rephrase this question, they can also ask you, how do you deal with short staffing, or how you will manage if you're understaffed? So you can answer, you will immediately inform it to your senior supervisor or floor supervisor, and you will try to arrange staff as early as possible, and you will stay till the time help arrives, or till the time next shift arrives, just to support the next shift. Or you will divide the patients accordingly so patient will not suffer, and you will make sure that their another shift is well organized, and you can also seek help from other department. So you know better how you're managing short staffing in your own department, so give them your best answer. Another one is, how would you manage job related stress? So you can answer as per your experience how you're managing job related stress. So for an example, you can say, after work I like to play with my children, and this helped me to relieve my stress. Or you can say, if you have any pet at home, you can say, I like to play with my pet, I like to take them out for a walk, or I like to listen to the music. Or you can say, while I'm at work and if I'm stressed out during my break time, I like to watch some comedy show, or I like to listen to the music, or I like to talk to my colleagues just to get some relief. So as per your experience, you can answer this question. Next one is very important, and this question comes in aptitude test as well. How would you break a sad news? And I think we all know how to do it, and every nurse should know how to break a sad news irrespective of your experience. And you can just add on that you will provide a quiet and peaceful room for the family or for the next of kin, and you should offer them a good place to sit or to be with somebody if they want to, and then you will break the sad news with your colleagues or with the consultant or whosoever is available. So last question for part 1 of this video. How would you handle a difficult colleague? So I'm sure you all might be handling difficult colleagues, and just to add on, just to give you some more idea, you can just add that I'll try to be as kind as I can, and you can also add on, you will try to discuss what's the problem and why they are so harsh to you, or why they are so rude to you. and you will try to ask them in person, and if they don't want to talk to you, you will bring up the matter to your senior, and you will discuss the matter with your senior that this particular colleague have some problem with me. And if they are like that, because they're gonna counter question you, that even if you're kind, even if you ask them what's the matter, and still they are being rude to you, still they're not behaving well with you, what you gonna do? So you just say, I will try to avoid them, I will not try to engage myself into any conversation which will lead to any argument. So as per your experience, you can wisely answer this question. Now I'll start with part 2, and these questions are particularly for the one who are working in ward. So let's start. So first question is, how do you prepare a patient who is going for surgery? So you should start from the very beginning, how you're gonna prepare a patient. So first by checking the identification of the patient, and then file, and we all have protocol for all particular surgery. So by following the protocols, and then preparing the patient as per the protocol, and informing the consultant, doing the checklist and skin prep. So you should include each and everything, any pre-medication, any allergies, and you should end your answer by then we will shift the patient to the theater, and we will hand over to the theater nurse. So you should say each and everything step by step. Next question is, while doing your nursing round, you overheard a janitor or a healthcare assistant being rude to a patient. What you gonna do in that particular situation, and how you're gonna manage that situation, what you're going to say to the patient. So in that particular question, you can answer I will try to understand the situation, I will try to resolve that argument, and then I will apologize to the patient. I will take out that particular healthcare assistant or janitor out from that argument. I'll report it to my manager, and I'll report it to their manager as well. Next question, and this question is also very important. You are the discharge nurse, and upon discharge you realize that patient dentures or hearing aids or stick or any of patient belonging is missing. What you gonna do, and how you're going to report it to patient and his family. So you can answer it I will try to search for his belonging in his own baggage after taking his permission, and then I will try to look for those belongings in the hospital press or ward press, hospital safe or ward safe, so we call it press here. And then you can answer it you will immediately report it to your hospital manager or your immediate senior, and every hospital has some protocol to report such incident to hospital administration. So you are immediately gonna follow that protocol, and you're going to inform it to hospital administration, and then you will follow the instruction of your senior or hospital administration, and you will inform the patient and family according to that instruction. Another one, what do you understand by audits, and have you ever involved in any audits, and what was your role in that particular audit? So every hospital and every country has some recognized bodies which perform annual audits. So you can answer this question as per your experience, if you have ever attended an audit, and how you attended an audit, and what all things you did before that audit. So all the preps which you did for the audit, and how you performed that audit, you can just say and answer this question accordingly. Next question, upon your medication round, you realized that you have administered a wrong drug to a patient. What will be your next step, and how you're going to deal with that particular situation? So your answer should begin I'll not try to hide it, I'll immediately report it to the doctor on floor, and then you will add all the nursing care and all the medication care which you will take care of, and then you will end your answer I will report it to my senior, and every hospital has some protocol of reporting such incident. So you will answer it I will follow the protocol, and I will report it to the quality control as well. Another question, you have received a new patient, and while taking history you realize that particular patient can be COVID-19 positive, what you would do. So you can answer it like, I will immediately follow barrier nursing, and then I'll send one urgent COVID swab if it's not being sent, and then I will isolate the patient. I will shift the patient to a negative pressure room, and then you can include all your nursing care, what all things you do after isolating a patient. And then you can add on the reporting procedure. You'll report it to your senior and hospital administration and whatever you do in such things in your own hospital. So now, end of easy questions. So definitely your employer at some stage, they will move to some medical or I would say theory questions. So they will never ever gonna ask you a direct question. Like, they're not going to ask me, okay, tell me what is cardiac arrest. No, they're not going to ask you like that. They will be asking you like, you receive one patient in ward and he's complaining of chest pain. What you wanna do? What will be your nursing action? So in that case, you can answer accordingly. I will assess the location of pain and characteristic of pain. If it's radiating to anywhere, I will take an ECG, report to the doctor, and like that. So they will never ever ask you a direct question on any disease condition. They will give you a particular scenario. So now I'm going to tell you the most commonly asked topics, and I spoke with some of the friends who are already working here, and they also told me that they are being asked about these topics. So you can study about these topics in particular, and if you come across any type of scenario like this, you can put your expertise in that particular answer. So most commonly asked topics are shock. So they can ask you different kind of shock, and you should be knowing how to rule out the type of shock and what's the nursing care for that particular shock. And then cardiac arrest, very very important. You should be knowing depth of CPR and rate of CPR in an adult and in an infant, and like everything about CPR and cardiac arrest you should be knowing according to the latest version as per American Heart Association. Another thing is MRSA, so how you will provide nursing care to a patient with MRSA. And then sepsis, how to rule out sepsis, very very important. What you're gonna do if a patient has sepsis, because sepsis is a medical emergency. So the first line which you should be saying is sepsis is a medical emergency, and make sure you mention all the nursing care which you have to take care if a patient has sepsis. And as a nurse, you should know how to rule out that a patient has sepsis. Other thing is safe blood transfusion practice. So particularly for safe blood transfusion practice, make sure you mention that you will check the blood in front of the patient with another registered nurse, and you will be counter checking the blood bag, you will be counter checking the patient identification, blood group, blood bag, expiry number, everything with another registered nurse. And make sure that that's the unit of the blood assigned to that patient. So everything which you do in your own country, because most of the thing are same in all the country, like the protocols are same in most of the country. So make sure you mention each and every step as you do. And other thing is, how do you manage a patient with bleeding? And then low HP, what you'll do if a patient has extreme low HP, what will be your nursing care? So these are the some commonly asked topic which are being asked again and again in all interviews. Be confident with all these scenarios because you already know everything. You just have to be very confident and familiarize yourself with all these topics, because these topics are being asked again and again in all the interviews. And again, I would say that they will never ask any of the disease condition directly. They're not going to ask me, okay, tell us what is hypovolemic shock. No, they're not going to ask you like this. So as per my experience and my colleagues and friends' experience, they will never ever ask you a direct question. There will be a series of scenario. So all question will be in that particular scenarios. So for an example, your interviewer can start a scenario like you admitted a patient and that patient is for surgery tomorrow. So how are you gonna prepare that patient? So here comes your first question: how to prepare a patient for surgery, or how to prepare a patient for theater. So you can answer them accordingly, and then they will put on another scenario. Okay, you received that same patient back from the theater, and you are the assigned nurse, and you saw that patient blood pressure is going down continuously. So how you want to manage it? And then you can answer your question accordingly, that I'll continuously monitor the blood pressure, I will check for any bleeding, I'll report the surgeon, I'll report the doctor on floor. And then you have to rule out what's the disease condition. So if you think if the blood reports and scan everything, after analyzing everything, you think that this particular patient is going into hypovolemic shock. So you can say that patient is going into hypovolemic shock, so we will give him IV fluids, we will check the HB, and if HB is low, we will transfuse blood as per doctor's advice. So they will take that particular scenario to, it will be like a sequence. So then they will say, okay, now the patient has settled, and patient blood pressure is okay, everything is okay, but patient has a high grade temperature. What are you gonna do? So then you have to think sepsis for that same patient. So you'll be answering the question, okay, I will check the lactate level of the patient, because in sepsis lactate level will be high. So if lactate is high, we will do x-ray, or we will inform the doctor and we will perform the test, we will do the blood cultures, urine culture. So you can answer accordingly, and then they will put you into another scenario with that same patient. Okay, now the patient is okay, you have given the full course of antibiotic, now patient has no fever, blood pressure is okay, vital signs are normal. Now you have to plan discharge for that particular patient. So what you want to do? So now you have to answer accordingly. Okay, we will as this patient is surgical, already, so you have to include wound information, wound education, medicine education, and if patient needs any further dressings at home, so you have to arrange public health nurse. So you will say all these things. Now they will say, okay, upon discharge you realize that patient dentures, crutches, or whatsoever is missing. So now here comes the question of missing things. So I hope you're getting what I'm trying to say, that they're not going to ask you direct question. It will be in a scenario. So there will be a series of scenario, and you actually have to understand what they are going to ask, and you have to answer accordingly. So that's all about nursing interview in Ireland. And as I told at the beginning of this video, that this video is particularly for the one who are working in ward, but I'll be uploading for ICU nurses, theatre nurses, and emergency nurses as well. So I hope this video would be useful for you. If you like my content, make sure you like this video and subscribe to my channel. It will take just 1 minute for you, but for me it will give me encouragement to make more contents like this. Until next time, bye bye, take care of yourself and your family. I'll see you in my next vlog.